much for taking the time for this NeedyMeds brief, Talk About Your Medicines Month. My name is Carla, and I am the Director of Education and Partnerships at NeedyMeds. And we'll get started with that. Who is NeedyMeds? NeedyMeds is a national nonprofit that connects people to programs free and anonymously through a website and helpline that will help them save on their healthcare expenses. Here is a screenshot of the NeedyMeds website, which really is the face of our organization. You can find healthcare cost savings information under the Patient Savings tab, and you can find educational information under the Advocates tab. I want to point out the announcement section. We are excited to share that the National Council on Patient Information and Education, abbreviated as NCPI, which was established in 1982, has handed off its educational resources to NeedyMeds, including their primary website, BeamMeds. The BeamMeds program's goal is to promote the safe use of medicines through trusted communication for better health. On the website, www.beameds.org, you can find information on the safe and appropriate use of medicines, safe storage of medicines, and the safe disposal of unused medicines. Here is a screenshot of the BeamMeds site. I hope you'll agree this site is full of important information on the safe use of medicines. We strongly encourage you to check out this website further. But for this webinar brief, we are going to focus on one specific initiative. Under the Get Informed navigation tab, a drop-down menu will appear. This is where you will find all the information you need about Talk About Your Medicines Month. So what is Talk About Your Medicines Month? In October 1985, NCPI sponsored the first Talk About Your Medicines Month. Now, in its 33rd year, this program, as part of BeamMeds, is an annual opportunity to focus attention on improving medicine communication, which can result in better medicine use and health outcomes. Over time, October's Talk About Your Medicines Month has expanded to stimulate conversations between consumers and their healthcare providers about all the types of medicines they may take, with a focus on what to know about a medication in terms of expected health outcomes, possible side effects, benefits, and potential risks. Each year, a theme is chosen. Here are examples of some themes from previous years. As all of these themes are still relevant, you can find out more information and resources for each of these previous years on the Talk About Your Medicines page of the BeamMeds website, which I highlighted in a previous slide. The October 2018 Talk About Your Medicines Month theme is Taking Action to Prevent Opioid Misuse and Abuse. Opioids are a class of drugs used to reduce pain. Opioids, prescription and illicit, are the main driver of drug overdose deaths. In recent years, there has been a dramatic increase in the use of prescription opioids for the treatment of chronic non-cancer pain, such as back pain, despite serious risks and the lack of evidence about their long-term effectiveness. You may have heard of methadone and oxycodone, which are the most common drugs involved in prescription opioid overdose deaths. Each day, more than 1,000 people are treated in emergency departments for not using opioid prescriptions as directed. An average of 115 Americans die every day from an opioid overdose. In fact, recent government data shows that close to 92 million people, that's 38% of the U.S. population, used prescription opioids from 2014 to 2015. So this year's BeamMeds Talk About Your Medicines Month was chosen because of these scary statistics and the fact that America has a drug problem that is touching the lives of all its citizens. So what can you do? You can empower yourself through education. Visit the Talk About Your Medicines Month link on the BeamMeds site, which I showcased in an earlier slide, and visit this website, www.talkaboutyourmedicines.org, created specifically to provide life-saving resources for opioid safety. This website will offer detailed information on what in fact are opioids, what drugs are in this category, how to take action to prevent opioid abuse and misuse, suggestions on how to guide your conversation with your healthcare provider, making it possible to make the most informed decisions with your doctor. You can find information on safe disposal, an important part of addressing opioid abuse, and there are resources for counseling patients with new opioid prescriptions. The call to action here is to visit the site, download the information, and share. It could save a life. I'm going to take a moment to answer some frequently asked questions. How can I participate in this year's Talk About Your Medicine Month event? You can use the Communications Toolkit on talkaboutyourmedicines.org. You can find a link for it under the Wave Building tab at the top. Post the graphic and propose social media messages on your own platforms. Under that Wave Building tab, you will also find ideas for observing Talk About Your Medicines Month. This link will give you ideas for planning an event in your community, how to write an article or a blog, and much more. Where can I find additional resources? On the Talk About Your Medicines Month website, under the Get the Facts tab, you will find a link titled More Resources. You can also find information on BeamMeds.org under the Get Informed tab at the top. How do I know if I or a loved one should take the opioid that has been prescribed? Go to Get the Facts on talkaboutyourmedicines.org to view and download pages specifically for Use Opioids Safely, 3 Key Steps, and Tips to Guide Your Conversation with Your Healthcare Providers. We hope you join us for some of these other upcoming webinars, and you can register for any of these or future ones on the calendar events on the bottom right-hand side of the NeedyMeds homepage. We encourage you to visit talkaboutyourmedicines.org to learn more, visit the NeedyMeds website, or give our expert call center counselors a call to learn about healthcare cost savings resources. And don't hesitate to reach out to me directly with any questions. Thanks so much for your time, and have a great rest of the day.